My name is Rosanna, and I am the admission specialist for the School of Dentistry. And like she said, I'm going to be talking about dentistry and dental hygiene today. Just give me 1 second here. Perfect. All right, we should have the screen back there again. Perfect. All right, so before we get into all the admission requirements, I just want to say that I'd like to acknowledge that the University of Alberta is located on Treaty 6 territory and respects the histories, languages, and cultures of the First Nations, Métis, Inuit, and all First Nations peoples of Canada, whose presence continues to enrich our vibrant community. So some people aren't aware of the different roles that people play within the dental care team. So I'm going to go over the 3 different roles. So dentists, dental hygienists, and dental assistants are all members of the dental care team, and they must collaborate to provide patients with comprehensive oral care. Dentists are in charge of diagnosing oral issues, developing treatment plans, performing procedures such as your fillings and extractions. They interpret the x-rays, and they'll provide guidance on oral health care to the patients. A dental hygienist role is that they perform the teeth cleanings, such as the scaling and polishing. They'll also apply fluoride treatments. They are able to take x-rays, and they educate patients on oral health care as well. Dental assistants assist the dentist during the procedures that they're doing. They also can take x-rays, and they also prepare patients for the dental procedures. They're also in charge of other administrative duties such as scheduling appointments and maintaining the patient's records. So obviously I'll be sharing a lot of information in today's presentation, but it's good to know how to contact us if you have any further questions after this presentation is complete. So you can reach us at admissions@dentistry.ualberta.ca, or you can call us at this number. We're happy to answer any questions you may have about our requirements. So for both the dentistry and dental hygiene program, our applications are always open 1 year in advance of the fall that you would like to receive admission. So between July 1st and November 1st is when applications are open. So for fall 2025 admission, you'd be looking at this July 1st to November 1st. You can apply through apply.ualberta.ca/apply. Also, the 2 programs have the same transcript deadlines. So because we're doing it 1 year in advance, we do look at the current academic year. So for 2025, we'd look at the fall 2024, winter 2025 academic year. So we get 3 different kinds of transcripts. The very first one is November 15th, which would be an unofficial transcript that has the fall and winter registration plus anything you've done previously. The next one we get is February 1st, another unofficial, which will have your fall grades and your winter registration. And then the very last one we need is June 15th, which is an official transcript, which means that it has to come directly from the issuing institution to the U of A. It can't be uploaded by yourself. And then that one will have your fall and your winter grades. If anyone here is currently attending the U of A, we request those for you. And then if you're attending institutions within Alberta that use the Apply Alberta system, we can often request these transcripts on your behalf. So the first program that we will discuss is the Doctor of Dental Surgery program, and then I will get into the Bachelor of Science in Dental Hygiene. So just to kind of give you a brief overview of the program, it is 4 years in length. In the first 2 years, you are more focused on doing didactic lectures. as well as participating in our simulation laboratory. So this is where you can see in this picture, there's mannequins that you will actually work on instead of people. And this is kind of where you learn your hand skills and positioning and just how to start working with patients. Also very early on, within the first few weeks of starting the program, you will be observing and assisting in the clinic with our upper year students. So you already get some experience in the clinic before you actually start working on people as well. Which brings me to the last 2 years, the third and fourth year, where you're going to be basically mostly doing patient care and working in the clinic practice. The majority of your practice will be done at the K Edmonton Clinic, where we have our oral health clinic on the 8th floor. Beautiful views up there. And then also something else that you'll participate in is we do have a lot of external rotations. So you may go to rotations at the U of A Hospital, the Glenrose Rehabilitation Hospital, and we also have a number of satellite clinics that we run up in northern Alberta. So I'm going to overview all of the requirements. You can find all this information at uab.ca/DDS. So there are basically 4 different requirements you have to meet. There's the academic requirements, the Canadian Dental Aptitude Test, our Situational Judgment Test or CASPER, and personal experiences. You may also need to provide English language proficiency and spoken English proficiency. You can find more information about how to meet that on our website. So the minimum academic requirements for the DDS program is that you have to have at least 2 years of university level study beforehand. So that's equivalent to 60 credits. And then we also require a specific course load, which is 2 fall-winter years with 30 credits in each year. That does not include spring-summer terms. It has to be done between September 1st and April 30th, the normal fall-winter academic year. These requirements can be either completed or in progress at the time of application. Like I said, that current academic year is considered within your application because you'll be done it by the time we would be considering offers for admission. I'll also add that credit received courses, credit given, whatever institution calls them, we do accept those. So then the next portion of the academic requirements is different subject areas that you have to have. So there's general chemistry, organic chem, cell biology, microbiology, introductory biochemistry, 2 of English, statistics, and 2 courses or 6 credits worth of human physiology. All the courses that are listed here are University of Alberta courses. If you're attending the U of A passing mark is the minimum requirement, so basically not an F. And then for any other institution where you'll be transferring those courses to the U of A, you would need to at least have a C-. For credit given courses, you just need to receive the credit. For some Alberta institutions on our DDS website, we do have an Alberta course list for some institutions that list what courses exactly meet these requirements. So you can find that as well on the website. The last part of the academics is the overall GPA. For fall of 2025, it's being lowered from a 3.5 to a 3.3. How we calculate our GPA is a little bit different than you might calculate it for other programs. The way we do it is we'll look at all full-time studies. So everything you've done that's been in full-time study. So what's equivalent to full-time study is within the fall-winter terms, you did at least 18 credits. That can be either 3 and 3 or any variation thereof, as long as it's a total of 18. For spring summer, that would be 12 credits. Because of COVID-19, we do exclude the winter 2020 academic grades, just because at the U of A and some other institutions did this as well, but at the U of A, we only provided credit. We didn't have an option for grades. So if you received grades for winter 2020, in fairness to U of A students, we will count it towards the number of credits you earned for that year so that you can have the fall included in your GPA, but not the winter. Another thing we do is that if you've completed 4 or more years of full-time coursework, we'll drop your lowest GPA period, except for your most recent full-time period, or if you only ever completed 2 30-credit years, we'll not exclude one of those. So that kind of covers up the academic requirements. The next portion is the Canadian Dental Aptitude Test, or the DAT. The deadline for us to receive that is January 15th. In the year you're seeking admission. So for fall 2025, it'd be January 15th, 2025. For that one, we usually recommend that you don't do the test any later than November 15th in the year before you're wanting to receive admission. So November 15th, 2024. That just really ensures that we get that mark by January 15th. Furthermore, if this is like the first time you're doing it, we do have a minimum score requirement of 15 in each of the 3 sections of the DAT. So we usually recommend attempting the DAT earlier in the year so that you can have the opportunity to retake the DAT before November. So then if you don't meet those minimums or you're not happy with the grades you received, that you can attempt it again. So you'd have to wait 60 days between attempts, and you can do it up to 3 times per year. We won't take a DAT that's older than 5 years on November 1st, so the application deadline. So you can definitely do it early, and you don't have to worry about it expiring for quite a long time. Also, if you do take the DAT more than once, we will take the best set of scores. If you want more information, you can visit the CDA website. So the next is the situational judgment test, which is the CASPER. It's an online assessment of non-cognitive skills and interpersonal characteristics and personal values and priorities, things that we feel would be important for someone who's going to be a dentist. The deadline is January 2nd. Usually the exam is offered between July to December in the year you apply. It's only valid for the current application cycle because they provide scores based on everyone that has applied for that period, and then they do it all over again. You can find more information about that on acuityinsights.app. It's also really important that you do the Canadian Professional Health Sciences test. There's a different one for dental hygiene. If you're applying to both programs, you have to do each one. Lastly, we have the personal experiences. This is a form that is available once you submit your application, and then the deadline to submit it through your Launchpad is November 1st. There's 4 different sections: employment, leadership and volunteer activities, life experiences and achievements, and personal highlights. Some of the additional information and prompts can be found on our website as well. For the employment and leadership and volunteer activities you provide, you do need to provide someone who is able to verify the information you provide. So you do all of that for your application, and then the next step is the interview and personal statement. So we usually send out the invitations by mid-February. The selection for the interview is based on the DAT score, the CASPER score, and the personal experiences score. I didn't mention it earlier, but when I was saying that the minimum OGPA is going to be a 3.3, it's really just a minimum. It's not competitively ranked. If you have at least a 3.3, you are considered for admission. So the interview is a multiple mini interview that's done online. There is stations that are 10 minutes long. You are provided a question or scenario and given 2 minutes to prepare your response, and then you're given 8 minutes to answer or respond to the panel. The personal statement is done on the same day as the interview, and basically we will give you a prompt that you have not received ahead of time or a question, and then you have 45 minutes to write a response. So after that will be the final selection. So we have 32 seats total for our program. Up to 3 of those seats can be given to non-Alberta residents. For that, we won't take any non-Alberta resident who, if we were to reject an Alberta resident that's more qualified. So you have to be fairly competitive as a non-resident. And then we don't have any limitation on the number of qualified Indigenous applicants. So qualified means that you meet all of our minimum requirements. So they'll receive an interview, and then they don't have any limit on seats, so we'll take as many as apply. The offers are typically sent from May to July, and the selection criteria will include the DAT, CASPER, and personal experiences that were used for interview selection, and then we'll also include interview score and the personal statement. So just to give you an idea of our applications for 2023, so not this year, but last year, we received or had 170 qualified applicants, the majority of which were Alberta residents. And then for those that we accepted into the program, we did take 3 non-Alberta residents and 1 Indigenous person who actually was admitted as part of the regular pool. They weren't an additional on top of the Alberta residents. So then that brought us to our 32 applicants. So just for an idea, that's 21% of applicants that applied got in that were qualified last year. For statistics, I do have GPA in here, even though, like I said, it's not used competitively. So it did range from a 3.54 to a 4.0. The more important sections will be the DAT sections, because those are used competitively. So we did have a range from 17 to kind of 27 for each of the categories, and then on average 22, 21. So just so you know how you're measuring up. All right, that covers all of the DDS program. I'll move right into our Bachelor of Science in Dental Hygiene. There's some things that are kind of similar, so I'll probably be a little bit quick through it, so then we can get to questions. So our DH curriculum involves a lot of the same things as the DDS program, though they're more integrated over all years. So didactic lectures, simulation lab work, clinical practices, and you can do the same types of rotations at those external clinics. And then for admission requirements, there's just 3 different kinds because you don't do the DAT. More information can be found at the uab.ca DHyge website. So academic, situational judgment test, personal experiences, some of the similar things. So for the dental hygiene program, you only have to have 1 year of professional study ahead of time, so 30 credits total. We do have a requirement to have a fall winter year with 27 credits in that period. So again, doesn't include spring summer term. That can be also done in any combination. If you are planning to apply to the first year of your program and then immediately apply, so you're kind of in the progress of your first year, to then get in the next fall. You can obviously take the minimum 27 credits, but I do highly recommend taking all 30 in the fall winter, just because the only next time you can do that last 3 credits is the spring. And if you recall, the deadline to receive final official transcripts is June 15th. And that's really close, if not before the spring term ends for different institutions. And if we don't receive a final grade on that transcript, then we can't consider your application. It's a hard deadline. So just keep that in mind if you're just going to be starting your next program next year. So some similar course requirements for the dental hygiene program. The chems, bio, English, stats are all the same. But this time you'll have sociology and psychology as a requirement, and then 2 courses and any options in any faculty, as long as they're transferring to the U of A. We also have some select institutions that are listed on the dental hygiene website for Alberta, so definitely take a look at that. Again, other institutions, a C minus, at the U of A, at least a D. For the dental hygiene program, the minimum overall GPA is a 2.7. It follows the exact same GPA calculation method that we do for DDS, except for the lowest year, we won't drop the most recent, or if you only present 1 year with 27 credits. Unlike the DDS program, the dental hygiene program does use the GPA competitively. It's the only piece of criteria used for the interview selection. So last year for 2023, the minimum GPA we took was a 2.77, but the mean for the applicants that were accepted was a 3.41. So just keep that in mind for kind of knowing what a competitive GPA is. I'll also say we do post the next year's kind of statistics usually in September, so you can get more updated information if you haven't applied yet. So the situational judgment test, January 2nd is the deadline for all of that. So I was saying earlier that there's 2 different tests. So this one does the Canadian undergraduate health sciences, whereas the DDS does the professional health sciences. So make sure you're taking the right one, or if you're taking both or applying to both, you will need to do both. For dental hygiene, there's a lot more limited opportunities to be able to take the test. Usually there's only 2 opportunities, one in November and one in December. So make sure you're on top of that when you're registering. So personal experiences are also the same. After you submit, there will be forms available through your Launchpad to submit all the different sections by November 1st, and you will need verifiers for those some of those activities. So for the interviews, like I said, they're based on the interim grades, so that'll include everything previous plus the fall term grades if you're attending. Those invitations also are sent out mid-February and run in the same multiple mini interview format as the DDS. For final selection, there's a total of 46 seats. Up to 4 seats are available for non-Alberta residents, and we have no limit on the number of seats for qualified Indigenous applicants. For selection criteria, it's basically everything: the GPA, CASPER, personal experience score, and the interview score. And those offers are also sent between May to July. For total number of applicants we received, last year we had 86 qualified applicants and we took 47 students last year, and only 1 non-Alberta. All right, so that covers everything. I'm going to run through a quick few typical questions I receive, and then we'll move shortly into questions. So one of the things I get asked a lot is, can I have my coursework evaluated before I apply? Because I want to know if I meet the requirements. I don't want to waste my time or those kinds of things. So we're not able to do unofficial evaluations. We get so many applications that we just don't have the time for it. However, when you do apply, we do our best to let you know everything if you're deficient in anything, so that you can try to make some changes for that. But you can use the admissions checklist that are available on both the DDS and Dental Hygiene website that really summarize all of the requirements, basically kind of just like these slides here. So then you can kind of check off things as you are kind of planning your academics and different things to make sure you're meeting all the requirements. Should I repeat a course that I got a bad grade in? Often something that people feel. So if you receive a passing grade on the first attempt of a course, you can not include your second attempt in your OGPA. So a passing grade for outside of the U of A would be a C minus, because you have to at least get a C minus for it to be transferable. So if you get below that, you're definitely welcome to retake it. But for the U of A, a not passing grade is an F. So anything above an F is passed. So you cannot repeat it again for credit. If you do repeat a course, like you're allowed to repeat a course, like you did poorly in it, you got an F or whatever, and you repeat it again, it doesn't mean that the course will be, the grade will be replaced. What will happen is we do the same thing where we look at full-time study. So if that F was in full-time study and the repeated course was in full-time study, then they're both included in your overall GPA. Do the required courses need to be completed during the minimum course load years? So, do I have to do all these requirements all at once? Do I need to repeat things? That kind of stuff. So all the requirements, especially these two, are completely considered separately, though it may be more efficient to use the courses towards multiple requirements. But the required courses are just a matter of did you do it, did you pass? And the course load is did you do 30 credits of something that's transferable within that period or 27 or whichever. Is having a W or a withdraw on my transcript bad? Withdrawn courses are not going to negatively impact your application at all. You just withdrew, you don't get credit for it. That's all that happens. Obviously, if you were trying to meet a course load requirement in that year and you withdrew from that course, you'd be 3 credits potentially short, which could affect things, but it's not that we're going to tally the number of withdrawals you have and take points off your application. Yes, they won't be included in your credits or your GPA. Last thing I'm going to just let everyone know about is that there is an organization called Pathways to Dentistry, which is run by current students within both the DDS and dental hygiene programs. Their goal is to increase access to these programs through a variety of different activities. You can connect with them online, either through Facebook or through their email address here. They also do annual information sessions as well, and they do a workshop where you can actually come and visit the simulation lab and practice your hands-on skills, which I think is really neat. But definitely, if you have more questions, I'm not the best person to ask about what it's like to be a student because I am just the admissions person. So if you really wanted to be like, oh, is it stressful? Is it hard? Those are the people you want to talk to. All right, I'm now open for questions, so definitely send them through the Q&A. So one person asked about competitive GPA versus minimum. So like I said, for DDS, there is just a minimum. It's not competitive. So that would be a 3.3. For the dental hygiene program, it is competitively used. So minimum is a 2.7. 3 or higher is definitely better. Last year it was a 3.4 was the average. The next question is for interview preparation practice. Does it strengthen responses to use personal examples in the MMI scenario responses? Being more personable, I would say, is definitely important. The interview's not just about answering questions, it's also about sharing who you are, what your experiences are. It's a lot stronger of an example than being like, I want to be a good dentist because that's the right thing to do, or a good person would just do this. But if you're able to provide a personal example, I think that would definitely help. Next is what are the parameters to decide how Alberta residents are decided? So Alberta residency is determined by continuous residency within Alberta, or I believe all the territories apply to that as well. And you have to live there for at least 1 year before the start of classes. So That would mean if you were applying for fall 2025, you would need to be living in Alberta at least from September 1st, 2024 to September or end of August 2025. That period of residency is not considered broken if you are away on vacation. You go to Mexico for Christmas, whichever. That's not considered you leaving the province or not becoming a resident. Short-term employment, or you're a full-time student. So if you were high school in Alberta, you've lived in here all your life, but then you decide you want to go to the University of Toronto for school, as long as you're only out of province when you're a full-time student. So if you're not taking full-time spring summer courses and you're returning to live in Alberta, come see your family in between academic years, then you'd still be considered an Alberta resident. Next we have, what is the procedure for checking transfer credit eligibility from out of province? So that one's a little tricky because there's not really transfer agreements between institutions like there is between Alberta institutions. Usually what I recommend as our best tool is there is an external science transfer credit database that the Faculty of Science runs, and depending on your institution, it's sometimes great, sometimes not so great. They don't put everything there. Unfortunately, it's stuff that they've already evaluated, so you can check there as a first place to kind of look, because then it'll definitely tell you what you want to know. Otherwise, for everything else, it's more of a matter of looking at the course descriptions, because we list all the U of A courses, so you can look at our course descriptions, compare them to your course descriptions, and kind of see what is kind of similar. I find that the more difficult ones are like human physiology, maybe sometimes microbiology. English sometimes is tricky, just because it should be offered by the English department. But sometimes they add a lot of writing courses under English courses. And for us, those courses may transfer as write courses, not English courses, and then they don't fulfill the requirement. So sometimes it's best to stay away from them. Sometimes they work, sometimes they don't, but it can kind of be a risky move there. Um, This one's one I get a lot. What is the best undergraduate program to take? So we don't specifically have a preference for different programs. It's not something we look at. And usually what we recommend is to take a program that you actually want to be in. Both these programs are really competitive, and sometimes you have to have a plan B. And a lot of people will continue through their 4-year degree till the end, trying to get in. But sometimes it's time to move on. And at least if you have a 4-year degree that you enjoyed and could see a future career in, then you have, you didn't spend a whole bunch of time on, nothing. Faculty of Science is really common, just because I think there's a lot of alignment with the interests that go there, but we get arts and business as well. You can check to see whether you have like options in some of those, but it's best to talk to an advisor specifically about those programs, being like, can I take this type of coursework just before you get into it? The only thing I think I'll additionally say is for dental hygiene on that Alberta course lists site, there is quite a few institutions where we put a warning where if you're hoping to complete all the requirements in 1 year, there are some institutions where you are required to complete 2 general chemistry courses before you're able to take organic chemistry, which means the soonest you could in the beginning of your program take organic would be in the spring. And that brings up that issue I talked about earlier where spring courses don't always finish in time. So sometimes that's just a thing to keep in mind about institutions you may be picking. If you're really wanting to finish in a year, or if you're planning to draw it out for 2 years, then there's no issue. But some people are caught off guard by that. And so we have some little warnings there for that. Um, what are some good experiences in previous roles which can help you stand out in the application process? I don't have, unfortunately, great recommendations for this because I'm not the person that evaluates it. We do have rubrics for these things, but we do try to leave them fairly open so that there's no specific, oh, we don't prefer this type of volunteering or this type of that. Usually the best kinds of things are, things you're passionate about, um, you know, doing things because you think it's just the right, the thing that'll get you into dentistry isn't always, it can come out um, in those kinds of things. So definitely, again, pick something you're passionate and excited about. It will show and makes you a more genuine candidate. This one I did kind of mention, but I'll mention it again because it doesn't hurt. For GPA, our courses taken in part-time or in the summer taken into consideration. So for the GPA calculations, it does have to be full-time study. And for that, it's equivalent to 18 credits in the fall winter terms, and spring summer would be 12 credits. So a lot of people don't do the 12 credit thing unless they specifically were planning to take a bunch of courses. So if you only take like one course or two courses in the spring summer, they won't be included. But if you take 12 credits worth, then that will be. Our fourth year students preferred over those that have only completed 2 years of undergrad. There's no preference that we know, no specific criteria where we said fourth years are better and 2 years is this much. Like there's no scale that we're using to rank people that based on their years of education. The only benefit to the 4 year would be that you can remove a GPA year. So sometimes with those, second year that, again, like I said, GPA for DDS isn't competitive, but if you apply and you don't do well in your second year and you're below the GPA, well, then it's kind of done. But for fourth year as well, if you had a bad year, it's gone now and you can just do great on the rest. So and that goes like, for dental hygiene, that might matter more if you're a fourth year for whatever reason, because again, your GPA might be a little bit more sound because you get to drop, a lot of people do poorly in their first year. So sometimes that's a benefit, but there's no straight up like fourth year is better and you get an extra bonus mark. Um, hmm. Is there a required post-studies residency after completing the DDS, or can I begin to find work immediately? Um, so, unlike medicine, where there's lots of residencies, usually there's time taken at the end of your DDS program for you to complete the NDEB exam, which is the national board exam, which once you pass that allows you to become registered as a dentist. And once you're registered as a dentist, then you can start working. We do offer a oh, now I'm forgetting what the acronym means, but it's a GPR program. It's meant for kind of an additional experience. It's not required, but some people, especially if they're thinking of going into a specialty after the DDS program, might do that. And it's kind of a paid practicum residency sort of thing. And there's one in Edmonton and one in Calgary. And I think they only take a few students, but that's the only thing, but it's not required to be able to practice dentistry. Are there scholarships, bursaries, grants, etc.? So that would all be under the awards. There are some awards that um, are specifically like related to grades and they're all internal. So I don't believe usually people apply for that or you're recommended, but you can definitely check out uab.ca/awards. That lists all the awards available. And there's other entrance grant scholarships, things like that.
I will quickly jump in
Oh,
about the the awards.
I appreciate
So,
it.
yeah. So the awards for students that are not starting, straight from high school. So transfer students, technically, all of you would be considered transfer students. You're coming into a professional program. Scholarships are on an application-based process only. So the timeline for these applications are from February 1st to March 31st of each year. Um, you can access this application through the awards website, like Rosanna was saying. It's uab.ca/awards. You're going to have to navigate through the page a little bit, but that application will consist of you inputting information about your academic performance, about your extracurricular involvement, your leadership, like leadership experiences. There's a few different categories. There's about 5 or 6 different categories. There is funding available for each program separately. So for example, there's a pool of funds available for dental hygiene students. There's a pool of funds available for DDS dentistry students, but that application is completely separate from the application for admission. So it's your responsibility to find that application and complete that again between February 1st, so coming up soon in a few weeks, and March 31st. And then once the evaluation process has taken place, if you have also been offered admission to your program and also then been offered a scholarship, you would be notified by the awards committee directly.
Thank you. I know we only have, well, no, like 15-ish minutes left, so I'm just kind of skimming to make sure I maybe get some of the more common
There's
questions
a there's a couple
here.
of people who are asking about transitioning from dental hygiene to DDS. Could you talk
Hmm.
maybe about if that's a possibility?
Yeah, so we do encounter people that enter into the dental hygiene that either afterwards or during are interested in entering into the DDS program. Um, So with that, it slightly depends on where you started out before you got into dental hygiene. If you got in right after your first year, that kind of, there's some certain things you have to be watching out for, but you have to meet all the admission requirements, obviously. So you have to have 2 years with 30. So if in your first year you didn't do 30 credits, you did 27, and then did like a 3 randomly or something else. As long as you did 30 in your first year, you most likely will do 30 credits, at least in your first year in the dental hygiene program. Again, you'll have to watch. Sometimes there's advanced credit that can be given for certain courses. So you have to watch for that. But the only things you're missing for required courses when you're going into dental hygiene as opposed to DDS is the physiology, the introductory biochemistry, and the um, microbiology. Those courses are all covered in your first year of dental hygiene. So there's a specific dentistry anatomy physiology course that is equivalent, that works for that. You take MMI 133 from the university, and there's a oral biochemistry that you take. So you can meet all the course requirements, the remaining ones through the dental hygiene program. But then you'd have to have, a higher GPA, at least a 3.3, and then just then it's a matter of completing everything else. So academic wise, it's possible to kind of meet the requirements, but it's just a thing that you have to kind of keep in mind there. Oh, I have an interesting one here on, it's a bit at the bottom, but thoughts on interview prep courses. Um, I can't say if any of them work. Sometimes I think those kind of courses especially can over prepare you where you're kind of not able to be more relaxed or honest, or you're kind of, you got blinders, you're ready to answer certain questions, and then a question you didn't prepare for comes up and suddenly it's deer in the headlights. So, and some of them are very expensive and it might not really be worth it. Practice is definitely good. Is it worth paying thousands of dollars to prepare for? Probably not. I know the U of A does offer some courses as well. I can't say if they're any good, but I think they're more on the cheaper side. But um, don't know if I'd say to spend lots and lots of money on it, because especially if you don't know if you're going to get in, because you only have a few weeks to prepare once you know that you've gotten an offer to come for the interview. Uh,
Rosanna, there are two questions about the Human Physiology Challenge exam. Could you speak about that option for
yep.
students?
Yeah, so I didn't really talk about it much. It's something that's relatively new. Something we were encountering was that there was some difficulty with out of province students in particular, even some in province, where the coursework at their institution was not meeting the standards of the Physiology 210 that we offer here at the university. And so to give those people an opportunity to prove that they do have the knowledge necessary, because it's not just a matter of meeting the requirement, the physiology, we didn't arbitrarily come up with this stuff. Human physiology is a necessary part of the foundation needed to then continue into the program and succeed. So having a not extensive enough of knowledge could greatly affect your success. So with the challenge exam, it is very specific. There's kind of three different scenarios that happen. Your physiology meets the requirement. You do have to do nothing additional. It doesn't meet the requirement at all, but it does make you eligible. It is enough to warrant that we will let you take the challenge exam, or it doesn't do either. So it's, completely off base, it's a animal physiology or it's just anatomy or something like that. So then what happens from there is, if your coursework isn't going to waive, but you are eligible for the challenge exam, we will notify you. There is more information about it on the website as well, but basically what happens is you need to have coursework that's eligible. So we are satisfied that the coursework is almost close enough, but not quite. So we want to test your knowledge. And then you do need to be invited to the interview. So you have to be competitive. You can't just go and take it just because. And then you'll come do the challenge exam. If you pass, then we will consider it waived. And I believe that results will be good for 2 years. I can't quite remember that information. Like I said, is on the website, but basically it's just a challenge exam that you would take before the interviews, and you would find out just before or around the same time you'd be invited to the interview and invited to come do the challenge exam. And yeah, that's pretty much it. If you have more questions, you can email us or check out the website. There's a whole section just about it.
So we have just over 5 minutes left, so it's time for me to start rationing the questions that are being posed. So Rosanna, could you talk? There's two people that are asking for the dental aptitude test. On the screen, they had listed the three different sections that are in the DAT. Is there
Mhm.
any value placed higher on certain sections, or are they considered equal?
Um, So we usually do not share the exact weighting of any of the criteria. So I wouldn't be able to answer that particular question.
Problem. Could you speak about if someone wanted to become an orthodontist, does that require separate schooling above the DDS curriculum, or is that included?
Yeah, so for orthodontics, it would be a separate program. You might get some initial exposure to it in the clinic, but you wouldn't be qualified to do orthodontics, braces, all of that, you might get to see some of it because within our oral health clinic, we have all of our graduate programs, implants and perio, odontics. We got quite a few different things, but orthodontics wouldn't be specifically included. So that would be a matter of entering into a graduate program. And then you would be able to take, then you would become a specialist in orthodontics. Anyone that graduates from the DDS program would just be a general dentist. I see one about the DAT and other exams in French. We only accept English. Mature student entry, and if you have the credit required, but you weren't able to do full-time semesters. So unfortunately for that, we do need you to have 2 fall-winter years with 30 credits in each year. So if you did a previous degree or you started your degree and the last 2 years you haven't done 30 credits, you would have to do those next 2 years. Or the difficult thing with if you've finished a degree is that you'd have to go into another degree in order to be able to take 30 credits. Most open studies programs are not, do not allow for full-time study, only part-time study. So you would have to start another degree program. Sometimes a master's will work, but it really depends on whether the courses are transferable or not.
And then could you speak about what students can expect in the multiple mini interviews, the types of scenarios or questions at all?
I can't comment on the scenarios and questions, mostly because I don't develop them and they obviously change every year. So we do have some sample questions on the website to give you kind of some ideas about things that might be asked. Oftentimes they are scenario-based questions, so keep that in mind. I do see one person asked about, the personal statements interviews being more subjective and how, what practices are in place to avoid any kind of favoritism, stuff like that. So we do have everyone signs a confidentiality agreement and declares whether they know of anybody who's applied, because we do use a lot of people from the community. So we don't pair people up that know each other because obviously that could create favoritism. For the interviews, there's 4 different stations, I believe, if I'm remembering correctly. Each station has 3 panel members. So and all of them score. And so I think it ends up being 9 people score you in your interview. So it makes it so that not, one single person could not extremely, swing someone's score from, great to terrible. So we have lots of people that do review these things. And then for the personal statements, it's all blind as well. Um, this one's an easy one. How long are previous courses eligible for? Don't expire. They're good forever. In our eyes. Did that one? Do we have to only take only fall and winter, or should it be either fall or winter? And can we take it in the summer too? I'm not sure if I quite fully understand the question, but I'll say required courses can be done whenever. Like I said, you can kill many birds with one stone by doing everything within the course load requirement, but if you don't, that's fine too, because it's just, did you do it or not? So that can be done at any point. For the course load, it does have to be fall, winter, can't be winter, fall, or things like that, or a fall, then a spring, summer. It has to be within the fall, winter terms. So for dental hygiene, I usually, if you're in your first year and you want to get into dental hygiene as quick as potentially possible, then do 30 credits and do all the courses.
All right, we have less than a minute left, so unfortunately, I'm going to have to wrap this up. This session has been recorded. I will be ending the recording in just a second, and it will be available shortly on our on-demand website, which you can access at uab.ca/on-demand. That's where this presentation will live for the future. If you have any other questions for Rosanna or for admissions into either the DDS, the dentistry, or the dental hygiene program, please contact them directly. They are obviously the experts in all things these programs and the admission requirements. And their email address is in the chat. If you've been here from the beginning, I put it in there a while back. It's admissions@dentistry.ualberta.ca, and they will be able to get back to you as soon as possible. So we'll sign off now. I just want to thank everyone for joining us this evening. I know it's a Monday, but we appreciate you being here regardless. And perhaps we'll see you at some of our other sessions over the next 2 weeks. And I hope that you have a wonderful evening. Thanks, everyone.
Thank you. Bye-bye.